Today we are going to discuss about prenatal growth of palate. Palate begins to develop 6th week of intrauterine life until 12th week of intrauterine life. It develops from 3 processes. The first one is primary or primitive floronasal process, and the second one is 2 lateral maxillary palatal shells. These elements are separated due to vertical orientation of lateral shells on either side of the tongue. Each palatal process fuses with the posterior margin of the primitive palate. Site of junction of 3 palatal process is marked by incisive papillae. 2 palatal process fuses each other in the midline, begins anteriorly and proceeds backwards. Medial edge of palatal process fuses with the free lower edge of nasal septum. Thus, regarding the formation of 2 nasal septum and then formation of the mouth happen. At the later stage, insoderm in the palate undergoes intramembranous ossification to form the half palate. Ossification does not extend to most posterior part of palate. It remains as soft palate. Line of fusion of lateral palatal shells is placed in adult by mid-palatine suture.